Their job is difficult. They gather the dead while they stay alive and prevent the virus from spreading. The World Health Organization says the rate Ebola is infecting people means there is community transmission, and the WHO warns without more public health measures, the virus could spread to new areas. The secretary of a displaced persons camp says people don't want to believe the disease exists, so he's explaining it to them. This woman says hand-washing instructions help, but at a different camp, this man explains they don't have enough water. The fact so many people are forced to cluster together is part of the problem.
Escalating violence in the east of the country continues to take a heavy toll on civilians, constraining aid operations and complicating our efforts to contain Ebola outbreak.
The head of the Africa Center for Disease Control and Prevention warns the current spread could eclipse the worst Ebola outbreak.
That would be the 2014 outbreak in West Africa, primarily in Guinea, Liberia, and Sierra Leone, where there were close to 30,000 cases and 11,000 deaths. Fortunately, this outbreak is nowhere near that.
Infectious disease expert Dr. Isaac Bogosh says the DRC's experience with the disease is helping, so is the WHO's response, quick compared to the last outbreak.
It took 2 years to get it under control, and we're really, at a few months. So we'll see what happens, but it looks like at least the right steps are being taken.
International partners like the UN, US, and Gates Foundation have promised $910 million US in total to fight Ebola, but the Africa CDC says the country has received less than 10% of that so far. Bogosh says health authorities can stop the spread, but need help to do so. Nathaniel Dove, Global News.